Come forward, Dr. Limas Kupčinskas, who's the chairman of the Lithuanian HCV Screening and Elimination Group. He's the chairman of the Division of Biological, Medical, and Geosciences of the Lithuanian Academy of Science and head of the Hepatology Unit, Department of Gastroenterology at Lewis Hospital in Lithuania. Thank you. I know you have to leave early. Thank you. Excellent. Thank you for
dear colleagues, I would like to share with experience of 1 year hepatitis C screening program in Lithuania. The program started last year in May, and planning the screening we based on our pilot study in Port City, Klaipėda, where was tested in primary healthcare center by general practitioners, about 5,000 consecutive patients by serological tests, and we reveal prevalence 1.7. It is average prevalence, and in hepatitis C seropositive patients, we reveal that most of them were infected by way of unsafe medical procedures, mainly related with blood transfusions or being blood donors before 1993, and only near 30% of patients were infected by use of intravenous drugs, and this findings in planning of our hepatitis C program was so reveal some differences in Lithuania in comparison to Western Europe countries. In most West Europe countries, seroprevalence of hepatitis C is low, and the highest risk is in so-called marginal group. In opposite of that, in Lithuania, the seroprevalence is moderate, and the main route of transmissions were through blood donation, the blood transfusion, and also other non-medical, unsafe non-medical procedures like tattoo, and the intravenous drug users was the significantly smaller group of possible way of transmission. Our initiation group of gastroenterologists and infectologists defined the two main target groups for which the hepatitis C serological test could be done by general practitioners. The biggest group is patients born between 1945 and 1994, before when hepatitis C testing in Lithuania was introduced. Also, the positive patient families members, and for them is foreseen once per life serological testing by general practitioners. And the second smaller group, it is marginal group, intravenous drug users, persons who were treated in addiction centers, and HIV patients for which serological testing is foreseen to do annually. And starting from the May of last year, about 8,100 of people was tested. It is about 1/2 of population foreseen for testing, and you can see that general practitioners tested very actively. At the beginning, the number of testing was lower, but after 5 months, it became as plateau, reaching the near 100 tested persons per month. So during first year, we tested, I tell, about 800,000 of people born before 1994, and also near 7,000 people of risk group, and really we tested of half of population foreseen for testing. Seroprevalence in a risk group was 31%, and in total population is about 1.5%. And patients seropositive patients was referred to gastroenterologists and infectologists. So the number of treated was about 40% of possible HCV RNA positive, but this delay was related with the sending procedures and some problem with drug supplying to Lithuania, because number of treated patients during the the last year increased 2.5 times in comparison to previous year, and it was not planned that so much patients needed treatment, and some treatment delay patients. Some patients are in waiting line for 3-4 months. And finally, what possible scenarios for achieving of World Health Organization targets for hepatitis C elimination in Lithuania? So we implement screening, treatment and screen and treat strategy, but of course we need also more work on prevention, especially on this marginal group, the patients in prison, because they could be the reservoir for new cases. And in case that during first 2 years we can test about 90% of targeted population, it was calculated prognosis that we could prevent 120 new cases of liver cancers, 90 cases of decompensated cirrhosis and possible liver transplantation, and 150 deaths from hepatitis C. So finally, we could conclude that the motivation of general practitioners to test and refer seropositive patients to gastroenterologists or infectologists for treatment is very high. It is necessary to solve some problems with treatment delay, but of course prevention or effort should be directed to target population, especially prisoners and also intravenous drug users. So, thank you.
That's an amazing program. It's one of the most remarkable programs I'm aware of in Hep C elimination. Just getting that planning and getting that national commitment to make that financial investment to promote testing at the family practice primary care level is truly amazing. Was it just your charisma and leadership that made it possible, or what was it? A personal story, professional expertise, modeling to show the impact? What do you think was helpful to get the national government to make that commitment? Microphone, please.
If I could say my experience why in Lithuania the such hepatitis C elimination efforts are quite successful. It depends on several factors. First of all, really, we do not have any elimination or screening program in Lithuania because the program usually require a lot of administrational efforts, different meetings, training, education, which require additional money. And in Lithuania, for healthcare promotion programs is special requirements, and it's require money. But we agree with our health authorities that we do very simple thing to introduce promotional service for general practitioners for HCV testing. It's of course, first of all, we plan that it will gradual testing for 10 years and with quite small expenses, but really during first year was tested half of really targeted population, and the health authorities agree that maybe now they have some resources for 2 years to do that, and further testing would be unnecessary, only expenses for treatment. And other, I could see, key factor of success that we involve in our negotiation with health authorities, the Lithuanian Europarlamentarians who knows about this program from some events in European Parliament, and we do the video conference because that time was COVID with health authorities, people from Ministry for Sick Fund, and also Europarlamentarians. And it is also was quite important some pressure from European institutions. But of course, for our sick fund, it was very impressive the simplicity of the program. Only simple promotional fee, no any other additional expenses, even if it was unnecessary, very big advertisement program. So it was quite, I could tell about our, how to say, way to this potentially success.
Yeah, no, you're on your way. It's successful in many ways already, and you're on your way to achievement of elimination. It's really, really remarkable. So thank you so much for sharing that with us, and we'll keep in touch.